This program is intended for informational purposes only and does not contain medical advice. As always, please contact your physician or qualified healthcare provider with any questions regarding a medical condition.
They call it a DRE or digital rectal exam,
Okay.
right? So, and you know this, I know you could speak to this as well. But the whole thing is with that is it's not an absolute necessity anymore. It is helpful to do.
Do you see my face right
yeah,
now?
it
You
is.
see
It
my
is.
face.
It is.
Welcome to another episode of Hot and Bothered with Melyssa Ford. Now, before I introduce my guests today, I wanted to get a little personal with you guys, if that's okay. Because up here, we talk a lot about health. And so I wanted to integrate a little bit about my own personal story into these conversations. Now, I have been healthy my whole life. Thank God I have never suffered from fibroids or endometriosis. I don't have any comorbidities. I have been healthy my entire life. So any interaction with doctors has usually just been, the annual health screenings, PAPs, physicals, and after the age of 40, mammograms. Boy, those are fun, said nobody ever in the history of ever. But I started thinking a lot about men and how avoidant they seem to be when it comes to going to the doctors and getting, shall we say, a certain type of screening. So a little while ago, I was at dinner with several male friends of mine, and I told them that I really, really, really wanted to find a Black male oncologist that's pretty much a unicorn, but I found one. He's my guest today. And I wanted to, talk to them about how freely they discuss amongst each other screenings for colon cancer and the screenings for prostate cancer. Now, if you don't know what the screenings entail, well, we're going to talk about that today. But I wanted to find out from them how impactful an episode would be with said oncologist. And they said to me, well, Melyssa, that's great and educational and informational, but we think that the most impactful thing that you could do would be to have somebody who is a cancer survivor or just a survivor in general of any of the primary killers of Black men. And I believe that number 1 is heart disease, number 2 is cancer, and number 3 is stroke. And I'm going to check with my guests today because I feel like stroke and heart disease kind of go hand in hand. But I thought, I would like to interview both of those people just to kind of have that full plate of information from somebody who actually went through it and not just the person who treats it. So without further ado, I'm going to introduce my guest. My first guest is Christopher Wlliams, not the singer, but just as amazing. Thanks for joining me, Chris.
Thanks for having me.
I've got Dr. Folu here. I do not want to butcher your name, Dr. Folu, so this is what I'm going to call you, but you could please introduce us with your full name and title.
Thank you, Melyssa. So my full name is Fiyinfolu Balogun, Folu for short, and I always like to say it's easier read than heard. When you read the name, it's no silent letters, and the name is pronounced correctly.
Gotcha. Okay, well, I'm not going to butcher it. So Dr. Fulu it is.
Yes,
and
that
professionally,
works.
You are an oncologist.
Correct, yes. So I'm a medical oncologist, and I like to define and let people know that when we think of oncologists, the surgical oncologist does surgery, radiation oncologist treats with radiation, and I'm like the medicine man. So chemotherapy, immunotherapy, pills, those are the things I use to treat cancer. And I focus on digestive cancers, more specifically pancreatic and colorectal cancers.
Okay, good. Because we're going to put a pin in that right now. In recent years, we've seen a lot of men pass away from colon cancer, most notably Chadwick Boseman. He didn't even make it to 45. He was 43 years old when he passed away from colon cancer. Just recently, DJ Clark Kent passed away at the age of 58. And before him, Reggie Osei, who was also known as Combat Jack, who was a beloved figure in the podcast and entertainment space and a friend to so many, myself included. He passed away at the age of 53. Black men are 40% more likely to die from colorectal cancer than any other group. So what we have is a track record of Black men not seeing the age of 60 and passing away from diseases that, from what I understand, they, with early detection, they are, there's a high survival rate, correct?
Correct.
Dr. Fellow? Okay.
Correct.
So, Chris, let me start with you, just because I want to get right to the whole experience of
Absolutely.
surviving cancer, but you also survived 2 heart attacks.
Right.
All before the age of 50.
Correct.
Okay, so give us the play-by-play as to what your life looked like at the time in which you suffered your first heart attack.
So my first heart attack, I was 42 years old.
That's young.
That's young.
That's
exactly.
really young.
And for the majority of my life, just to paint a picture, I was in really good shape. So I used to run a lot with my dad. I played soccer growing up. I swam, was in good shape. Then, fast forward, got married, kind of fell out of shape. And then when I got divorced, got back into a rhythm of getting myself back in shape and living a better life. And then out of nowhere, I had my first heart attack.
Okay, now stop there.
Yeah.
Where were you when you had the heart attack? What did it feel like? What were the symptoms? And what was the first thing that you did? Did an ambulance have to get called?
No,
was it
no. So it's interesting that you said that. So was going to the gym 6 days a week, really good shape. I was sitting at my desk at work.
Okay.
I was working as an executive recruiter at the time. So I'm at my desk and started feeling chest pains. The chest pains felt like heartburn. So I'm thinking, indigestion, because, I don't get heartburn. So I'm like, what did I eat? So I was like, okay, cool. Let me get some Tums. Got some Tums. It persisted and it kept getting worse. So I called my doctor and was like, something doesn't feel right. I think I need to come in earlier, because as luck would have it, I had an appointment with him that day. Made it from my office in Midtown in the Grand Central area to his office, which is on 68th Street by Hunter College. And when I got there, I got progressively worse. Like I felt like my legs were just sinking into the ground. I started feeling heavy. Then I felt the tingling sensation in my left arm. So that told me that I was having a heart attack, because I knew what the signs were.
And did you tell your doctor, like, dude,
no, I didn't
I
didn't need to tell him, because
Okay.
I once I got into his office and his receptionist took a look at me, she called him, he came out, they rushed me in because I was sweating profusely now. I felt like someone was sitting on my chest, like it was bad. They called the ambulance. Like he didn't waste any time. The ambulance came, took me, at the time I got treated at Lenox Hill, and it was interesting because EKG, chest x-ray didn't show any signs of a heart attack. They had to do blood work to check my cardiac enzymes. And that's what led them to know that, because my cardiac enzymes were very elevated, led them to discover that I was having this heart attack.
Okay, so you've had 2 heart attacks.
Yes, almost 3.
Oh, wow.
4 cardiac stents, 4 coronary stents, yes.
Does heart disease run in your family?
No.
Or is this just a genetic abnormality with you?
So there is a genetic abnormality. It was discovered that, and just recently, by one of my latest cardiologists, because I persisted to find out, like, there's got to be something going on. And I have this thing called LPA, lipoprotein A, or little a as they call it, which basically, as he explained it, it means my cholesterol is turning into plaque at a faster rate.
Okay.
So even though my cholesterol is perfectly normal, like it's like a 120 or something like that.
That's good.
Yeah.
Mine's like 220.
Yeah, there's nothing, it can't get any lower. Like there's nothing, according to him, diet, exercise, nothing else I can do. Obviously, poor diet will worsen things. But the bottom line is I have a good diet. Yeah, I have a good diet. I try to, manage my stress, do a pretty decent job with that. But unfortunately, this is something that I have to live with.
So in between these 2 heart attacks is when you found out you also had cancer, correct?
Yes.
Do you ever look up at the sky and be like, dude,
No.
like, what now?
So check this out. You want to hear the funniest thing is,
Yes.
I actually
you
said,
gotta have a sense of humor.
yeah,
at this
no,
point.
you have to. But I actually said that cancer saved my life, and people
Said
be like,
nobody ever. But go
yeah,
on.
but I said that because had I not had, well, maybe appendicitis saved my life. So I had appendicitis, right? And appendicitis, when I went in, they said, oh, we got to do this appendectomy, blah, blah. And then they found the tumor sitting on my appendix. And with that, that's how they discovered I had this cancer, and it was stage 3. So had I not had appendicitis, not gone into the hospital for this thing would have turned to stage 4, and I wouldn't be here. But the reason why I said cancer saved my life is because it actually gave me purpose. I think I was kind of just moving through life. You know, I thought I was doing the things that I love, but I really didn't latch on to what my purpose was. And getting diagnosed at the age of 48, it was very clear to me what I was here for. So maybe not. Yeah, cancer did. It gave me purpose, and it changed my life for the better.
And so that is when you decided to start Heart, Body, and Soul
Yes,
Inc.
yes,
Okay.
yes.
So tell us a little bit about Heart, Body, and Soul Inc.
So, you know, we're talking about men, and we're talking about especially, I will say, especially men of color, especially black men.
Yes.
We just don't do what we're supposed to do. We're not going to the doctor when we need to. When we talk about doing these colonoscopies or you know, getting our prostate checked, these are things that we have this preconceived notion, or these myths and sort of, we get into this mindset of, I don't want to do this. And so what I wanted to do was create a platform and a space where we could break down these stigmas and really address the issue. And the issue is that we need to prioritize our bodies. We only have one. So if we, you know, continue to move through life thinking that, you know, there's no need to do this because I have like 5 jobs and all this other stuff, and I want to take care of my family, then you really don't love your family, because you got to love yourself first to be able to take care of them.
That's very true.
You know, so I mean, you know,
And your wife does not want to become a Medicaid wife.
Yes,
She did not sign up to be a nurse.
yes.
Hello. Okay.
Yeah.
I just want to let you guys know that yes, she is there to love you through thick and thin, in sickness and health, but don't exacerbate the situation. Don't speed it up on her. Okay.
Exactly.
So do her a favor.
Exactly.
Is there any success stories that you can share, like from your organization, that illustrates, you know, like the power of early detection?
Yeah, I mean, it's been a few actually, but I will share one. There's a buddy of mine who called me. He was dealing with heart issues, and he was having these chest pains, and his doctor said that it was anxiety. And I said, describe the pains to me. And when he described it, now obviously I'm not a medical doctor, so but I think I'm a bit of an expert on heart attacks. I got some experience. Yeah. So I said, describe the chest pains. And he told me, you know, what they were like. I said, are you feeling fatigue? He said, he's always tired. Now, this is a guy who's in great shape, plays tennis, you know, exercises, whatever. So I said, here's what I would like you to do. Go back to your doctor and ask him to give a stress test. Not a regular stress test, but a nuclear stress test. So this is where they can get a closer look at what's going on with your heart, see, you know, how the valves look, that kind of thing. So he ended up having to get triple bypass surgery.
Wow.
Yeah. So,
but yet his doctor said, it's
yeah,
just anxiety.
Yeah. You know,
let me give you an antidepressant. That's what they love to shove down our throats.
Yeah,
as women going through perimenopause.
Yeah, this is a problem. And this happened with me with almost my 3rd heart attack. Right, it's the same thing where they weren't listening. The doctor said, "Oh, you know, we think it's maybe angina, so we're going to give you nitroglycerin." And it wasn't. So the bottom line is that was one success story, but there've been others in terms of people getting their colon cancer screenings. A friend who also had high cholesterol and wasn't on any medication. He was extremely fit. So he thought, oh, you know, it's something that maybe runs in the family. But come to find out, he was on the verge of potentially having heart disease, developing heart disease as a result. So he got on medication and he's doing much better now. But these are all through conversations, through me telling my story. And this is why I started Heart, Body, and Soul, to really open up and get men to open up and have more open conversations about their health so that they could do something about it.
Okay. So with you opening up, you know, creating this organization that creates the safe space for men to come in, talk to people, raise awareness, get screenings or be pointed in the right direction. Right. Dr. Folu, I want you to kind of jump in here. What role do you think the idea of masculinity being challenged plays in why men, specifically Black men, avoid these types of screenings?
Wow, that's a deep question.
But I have my thoughts, my ideas on it.
I think it definitely plays a role. I think the idea of not wanting to be vulnerable, not wanting to show any vulnerability, plays a big role in almost shutting the door to trying to identify anything that could make us weak or that could be seen as, oh, there's something wrong with us. I think it plays a big role in there. While I'm not a psychologist, it's something that we see. I don't want to put it just on that. There are other factors that come in the way of Black men. And
I do have a true or false for you in regards to other factors. So I'm just going to run them down and then you tell me true, false, or needs a little bit more information. Okay?
Good.
So number 1, genetic susceptibility. African American men have a higher genetic predisposition to aggressive forms of prostate cancer. Certain genetic mutations also increase the risk for both colon and prostate cancers. True or false?
True.
Okay. 2, healthcare access and utilization. Limited access to quality healthcare, including screenings and early detection services, contributes to higher rates of late-stage diagnosis.
100% true.
Okay. Socioeconomic disparities, such as lack of insurance or financial resources, may delay or prevent timely treatment.
True. Tied to the second one.
Okay. 3, lifestyle and environmental factors. Higher prevalence of risk factors like obesity, physical inactivity, and diets high in processed foods and red meat can increase cancer risks.
True.
African American men are also more likely to live in areas with limited access to healthcare, to healthy food options, food deserts, and recreational facilities.
True, unfortunately.
Okay. 4, healthcare disparities. Racial bias in the healthcare system can lead to differences in treatment quality and outcomes. Studies show that African American men are less likely to receive aggressive treatments or participate in clinical trials.
True.
Chris, do you have any, experience, since you have spent the last pretty much decade in and out of hospitals, did you have any experiences, and I think you alluded to it in the beginning, where doctors basically just kind of, tried to shoo you away and say, oh, it's no bother, it's no big deal, whatever. And did you attribute that to...
Yeah, I mean, so I will say this. The doctors that I had the interaction with, I don't think it's necessarily, what I attributed is to a lack of education, right?
On the doctor's behalf?
On the doctor's behalf, right? Because what's happening is, and I understand this as I've met more doctors and been in that space, is, certain doctors are not attuned to the communities that they serve, right? So there's cultural sensitivity that needs to be addressed. They need to understand more how to interact with folks and how not to be dismissive. That's why oftentimes women are dismissed when they talk about pain, and especially Black women, all right? And the same with Black men, right? So I've had conversations with those same doctors when they do dismiss me and say, listen, no, it doesn't work like that. When I had my first heart attack and they were removing the catheter, which if you can imagine a balloon catheter in your groin and it coming out, it's okay. So I have no idea what it's like to be pregnant or be in that position. So I won't even liken it to that, but the pain was intense. So now this guy is telling me, calm down. It's not, I'm like, what do you mean calm down? Do you understand the pain of, as I had to say to him after everything was done, I said, have you ever had this done? He said, no. I said, well, here's what you do. The next time you're doing this, don't tell a patient to calm down. Instead, put them at ease. Say, listen, we're just a few more minutes. Say something calming, but telling me to calm down as your patient who's in intense pain is only going to infuriate me. So conversations to educate, which after that he received it well. He apologized and he said, I will take that under advisement and won't do it again.
I appreciate that because one of my previous guests, I had her on to specifically talk about how to advocate for yourself when it comes to interacting with doctors and having your concerns or your pain being dismissed. It is a very, very real thing that a lot of people experience. And thankfully, your doctor was open and receptive to what you had to say and then apologized. Like, wow, that's kind of surprising. Okay, so let me go on with the list and you keep on going. Let me know, true or false.
All right.
5, screening gaps and mistrust. Lower screening rates among African American men due to fear, mistrust of the healthcare system, lack of awareness, and results in cancers being caught at advanced stages.
True.
chronic inflammation, and comorbidities. African American men have higher rates of chronic conditions like diabetes, hypertension, and IBS, which is irritable bowel syndrome, which increase cancer risks.
True.
Biological differences in tumors. Research has shown that prostate tumors in African American men tend to be more aggressive and harder to treat, though the exact reasons are still being studied.
True.
Okay. With all that being said, we had a discussion offline about the importance of clinical trials and how it supports research. How difficult do you find it to encourage Black men to participate in clinical trials to try to find out more about why colon cancer and prostate cancer affects them disproportionately than their white counterparts?
It's not difficult at all.
Really?
Nope.
They serve themselves right up on a platter.
And that's the problem.
Okay.
So a lot of the
It's just the fact that they're not asked,
yes,
correct?
That's the problem. Like they're not asked, and even when they're asked, they're not presented all the information. Okay. So whether you're in a rush as a doctor, got a couple of minutes with the patient, or you decide subconsciously without knowing it that this person will not be able to do this trial because it requires them to come into the city, blah, 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 you may choose not to offer them, or you may just gloss over it. If you present me with something that I don't know the details of, I'm likely to say no. But studies have shown, and I experienced it too, if you do present anyone, whether it's Black men, women, other underrepresented groups, you present them with clinical trials and give the information, even when they're not English speaking, different languages, they take it in, they ask very insightful questions, and they're willing to participate in the trials. Mm-hmm. Obviously, sometimes some people would come in with the impression that I don't want to be a guinea pig. Mm-hmm. And that's legit, but you have to explain it to them. And it's not that hard to get them involved in the clinical trials or interested.
Okay, well, I want to move back to, screenings and early detection. I am on a podcast with a lot of men. I'm the only woman, as a matter of fact. And I try to lead by example. I post all my gym videos. I come in there with my salads, and I'm not gonna rat them out and talk about what they eat and what they don't do in the gym. But they're my friends. And so I, kind of share my concerns with them. As we get older, we start to live more sedentary lives. Our lives get busier. Mm-hmm. We're getting older. So it's a little bit, you just get tired a lot of the time. You're like, I'll go to the gym tomorrow. And then tomorrow becomes next week, becomes next month, becomes next year. And that gym membership goes to waste. But I'm seeing the men that I'm around kind of exhibiting habits that their younger selves can get away with, but their over 40 selves, I'm like, I start shaking my finger. You got to watch out, because plaque will start creeping up into your little coronary valves, and also your cholesterol will shoot up, and so will your blood pressure, and all of these, they're called comorbidities, correct?
Correct.
Exactly.
And risk factors.
And so I find that the one thing that they really are the most frightened of is getting the finger up their bum. I'm sorry. For me, listen, as women, we go through so much. We get our boobs smashed in between two plexiglass plates. We get like medieval devices, shoved up inside of us. We go through so much. So that is the one thing that we get to, enjoy mentally, that picture of our men in their most vulnerable state. I'm sorry, I'm being honest, okay? But tell us, what are the most effective methods for screening and early detection? How often should men be doing this, and when should they start? And not necessarily just men, women too, because, prostate, we don't have prostates, right?
No,
women? Okay, just checking. Okay. But we definitely have colons, and my mom passed away from colon cancer, so I know that I'm of an increased risk. So I had my first colonoscopy at 43, and I am due for my next one. Wait, 43? No, sorry. It's 46. Yeah. And I'm due for my next one next year. So I have to go every 3 years. So what are the most effective screening methods for early detection? How often should men be getting this, or people should be getting this, and when should they start?
Yeah. So colon cancer really talking about colon cancer here, it's probably one of the only cancers where we know what it looks like before it becomes a cancer. So we can really go in there, see a little polyp and say, you're going to become a cancer in 10 years. Let's just take you out. And that way we've cured the cancer before it even started.
That's my story. Is I had my colonoscopy, so I drank the liquid, I drank the whole concoction that you have to drink over the course of 24 hours. You can't eat any food, and you're drinking like light Gatorade and Miralax, just bottles
That's
of that, okay?
Yeah.
And you're just like flushing the whole situation all day long. Just don't go anywhere. Don't even walk your dog. Don't go anywhere for those 24 hours because anything can happen. And so the next day I got to the, I got to the facility, to the medical facility, and they got me my gown and everything like that. And they told me after, they were like, wow, you did really good with the, with your prep. You were clean as a whistle. I, for some reason, felt like I'd achieved something. But they said, we found one polyp. And if you had not come in and gotten the colonoscopy inside of a year, it would have been cancerous. So I know exactly what you're talking about when it comes to seeing it and identifying. So go on.
Yeah. So, I mean, that's the idea of the screening. Like we find it, you don't have any symptoms, it's not a problem, we take it out before it becomes a problem. And nothing beats that. A lot of the advances we've made in terms of survival and improving survival with cancer most of it has come from preventing or catching it early. While we have all the fancy new medicines that treat it, nothing beats catching it early. So with screening for colon cancer, the colonoscopy is our gold standard. And it's more than a finger in the butt. It's a whole camera tube that goes in there, but it's a thin camera tube. The part of that that's the most challenging, which you described and you aced, was the cleaning out, because you're just cleaning out yourself the whole day. It feels crappy. But the advantage of the colonoscopy is you go in there, if whatever you find that looks abnormal or that looks like a benign polyp, a gentle polyp that will later become cancerous, you take it out. That's been for a while the primary aim, the primary recommendation. But in recent years, we realized that a colonoscopy is not the easiest procedure to prep for, but also it requires you to take a day off work, requires someone to go there with you, and not everyone has the ability or the luxury to do that. And now we have stool-based screening tests for colon cancer.
Like Cologuard.
Exactly.
So I was going to ask about that because I see the commercials on TV all the time, and I wondered if that is an effective screening method for everybody, or if there's some people that get excluded from it being effective for them.
It's not effective for everyone as the way a colonoscopy is. Colonoscopy is still the gold standard. The advantage the stool-based testing has is people are more likely to do it. Once a year, stool testing, and that's it. But if it is positive, you still have to do a colonoscopy. For the Cologuard, for the stool-based testing, it's typically for the average risk person. And we can talk about what average risk or high risk is later on. The colonoscopy for all kinds of risk. We just adjust how frequently we do the colonoscopy testing.
But please expound on who is the most at risk.
So average risk, essentially, when we think of risk, we think of risk factors. And when you are talking about your friends, your co-podcasters, and as we get older, that's one of our risk factors, age. The older you are, the more likely, the higher the risk of getting colon cancer. And it's what we call a non-modifiable risk factors. Nothing I can do is going to make me younger today than I was yesterday. But the other things we do, watching our diet, being more active, doing our screening, those are the ways we can mitigate that higher risk of getting older. So for the average risk person, essentially you have no high risk features, which is a family history of colon cancer. You don't have that. You don't have any diseases like IBS that increases the risk of colon cancer, or there's no genetic predisposition that increases your risk of colon cancer. So when you don't have any of those, you're considered average risk, and you start screening for colon cancer at the age of 45. Used to be 50, and it's been several years that it's been brought down to 45, but even in my interaction with black men in New York and other people, many people still don't know that it's 45 yet. But 45 is the age, average
Okay,
risk.
so Chadwick Boseman died at the age of 43. He was younger than the prescribed age for screenings to start. I don't know anything about his journey through, dealing with colon cancer, what his doctors told him, how he discovered that he had it, why it was terminal, et cetera, et cetera. But what happens for people that are younger than the screening age? Like I wonder to myself, how could an early screening for somebody like him have prevented the outcome? Because the mandate is for 45 years old. So what happens in that kind of circumstance? And also, I guess a better question would be, what might somebody be feeling by way of symptoms, that might alert them to something is not right when it comes to their colon and their rectum?
Yeah. So, for the first question, it is without knowing details of Chadwick's history or family history and not being able to tell what risk factor is. I've had unfortunately a few patients that know average risk and were diagnosed with cancer earlier than the recommended screening age. The recommended age the truth is, with most things, it's designed to capture most, and they try to find a balance where you're not over screening because it causes harm, but you're also not losing out on skipping too many people. But it just doesn't capture everyone. Now the part where the next question you ask about the signs, it's very important. When we talk of screening, it's when you don't have any signs, just what we should be doing. But when you have signs, and this will tie back to what Chris was talking about, what he has mentioned several times, it's really your body. When something is off with your body, you know it better than anyone else. You can go see this doctor and they would say, oh, it's nothing, but you just feel like it's not just gas. It's more than gas. So you have to persist in that. But symptoms include blood in your stool. It's abnormal. Yes, you may have hemorrhoids, but let someone look and see, is it truly hemorrhoids or is there something more to that? Changing your bowel habits. So if you're usually regular when you go to the bathroom for number 2 and you're having your bowel movements on a daily basis, but you notice, all right, I'm starting to have constipation, which is odd.
Frequent constipation.
Yeah, okay. Frequent constipation, which is unusual for you. Or diarrhea, any change in bowel habits. Abdominal pain, obviously anything should be investigated. And if you notice more advanced symptoms, like if you're getting easily tired, that could be an indication of more advanced cancer, but it could even be an indication of an earlier cancer, but you're just slowly bleeding without knowing it. So your blood levels are decreased. But any of these signs that you have, go find a doctor, make sure that it's evaluated. If you don't like the response you're getting from one person, keep going till you find someone who will do the proper investigation for you.
So I want to go back to the stigmas, the cultural and societal stigmas around health concerns when it comes to Black men specifically, especially involving, intimate areas of the body. What would you say is the rate in which you find patients at late stage colorectal cancer?
So I'm a little biased in what I see, being that I work at a cancer center. So by the time I see patients, it's already been diagnosed, and typically also the more advanced ones. But for colon cancer, we do have a good, I'd say majority of patients are diagnosed at an earlier stage. I do see more advanced cancers than the average.
Do you talk to them?
About the...
do you just sit down and get the story behind why they avoided coming in, what the avoidance was based on? Do they
Yeah.
ever say it just was not the manly thing to do? I just did not want anybody poking around back there. Like, do they actually say this to you?
No, I do talk to them, and a lot of it is more not fully understanding or appreciating what should have been done.
In what way?
So not even knowing that they had to do the point or the value of doing these screenings. So it's like, oh yeah, I've heard about that, but I just figured it's something that we do, but not really understanding that it's a difference between finding a cancer at a point where we can cure it with minimal treatments or using more aggressive treatments and still not be able to cure it. I think the information out there is just not sufficient enough. There are instances where they know, but they just didn't have the time. It's because of work or because of family or things they had to do, and they kept pushing it back. But in more cases than not, it's just not there. Just the awareness is not there, not fully there.
Okay, so I'll bounce the question back to Chris, just because this is what I believe that Heart, Body, and Soul Inc. does.
Right.
Its main mission is to raise awareness. When
Right.
people say they're raising awareness, you're like, raising awareness for cancer. It's like, okay, well, we know it's here. We know it exists. Raising awareness. So this is what raising awareness actually is. Raising awareness for understanding there are screenings that you need to take, you need to do for your health to basically just understand where you are, like what's the baseline you're at. So what are the ways in which you try to raise awareness and let men understand these are the screenings that you need to do at these particular ages in order for you to understand what your baseline of health is?
So, and great question, and thanks for that. A big part of what we do is making sure that we bring our hospital partners along. So the doctors are there so people can ask these questions, but we want to make sure they understand that regardless of what your income level is, regardless of whether you're uninsured, underinsured, or undocumented, there are services available for you to screen. And so a big part of the barriers for a lot of people that I interact with, especially Black men, is that, well, I don't have the money, I don't have insurance, or, my insurance, I'm not sure if it's going to cover it or something like that. And then, of course, I deal in communities where there are people who are immigrants who don't know that they have the option to even go in. So we really want to get that information out there so people know that regardless of what their status is, they can get these screenings. So you can get a colonoscopy. You can go and get a PSA blood test, which is prostate-specific antigen to screen for prostate cancer. A lot of people.
Wait, hold on one second here.
Yeah.
So the finger up the bum is not.
Okay, so that's so. Okay, so that. So
I was about to say
hold
that
on.
is the only thing that I can hang my hat on. Okay.
So here's the thing. So they call it a DRE, or digital rectal exam,
Okay.
right? So and this. I know you can speak to this as well. But the whole thing is with that is it's not an absolute necessity anymore. It is helpful to do.
Do you see my face right now?
Yeah, it
You
is.
see my face.
It is helpful, and there are doctors who still do it because doctors, especially the doctors who are more, experienced in understanding what to feel for and how to check for certain things, doing that is helpful. But you can get a blood test, which is a lot less invasive, and that can give you the results to determine whether or not you have prostate cancer or maybe at risk for prostate cancer.
All right, you hear that, guys? So now, look, you can avoid the finger up the butt, okay? In 30 years, they have not improved the technology to, for our mammograms, but boy, did they figure it out for y'all. They figured it out for y'all, okay?
Well, I'm hoping that they figure it out for women, too.
I
because
want them
really,
to figure it out because this sucks, okay? Thank God I have boobs to place in it. I don't know how A-cups do it.
That's what I was going to say. I have friends who struggle with that.
Yeah.
Wait, what?
It's
It's like
traumatic.
I don't even know. Okay, but hey, let me just ask this, just because I have to know.
Yes.
Maybe not you. Well, I mean, maybe you can answer. What are they feeling around for? Like, what? Tell me. I'm sorry. We are supposed to be serious right now.
No,
okay?
listen, this is fine. We need to, laugh about it.
But-
Go ahead, Foley.
So what does a normal prostate feel like versus one where it's just like, oh, you're in trouble? Tell me about it.
So first, we're sorry to steal your joy of just thinking of men going through the finger up the butt.
I'm sorry.
But really, the prostate is this small. They describe it as a walnut organ right there, and you get to it.
Wait, hold on. Where is it?
It's right. Think of it as at the base of the penis, like deep in there, like where it starts.
Okay.
But you get to it through the anus. So you stick the finger up the butt, and you can feel it. You can palpate it. And if it feels smooth, then that's good. But if you feel some lumps, some unusual lumps there, then that's what's concerning. But
okay.
like Chris
See,
said,
now you can't get that with the blood test. All right. So it's tried, tested, and proven. Tried, tested, and proven. Okay.
that part is true. You can't get that with the blood test.
Can you imagine a female proctologist with nails like these? Huh? That would be a disaster, right?
It would be.
I did have a female proctologist, but
the nails are not like that.
Nails are not like that.
Okay, hold on.
No,
This is a total sidebar conversation. Who decides out of med school, I think I'm going to go into proctology? Who decides that? Like the doctors that I'm like, why? Proctology, podiatry, there was an endocrinologist. Well, not really, but they're just kind of weird sometimes. But proctologists, I've always wanted to interview one and say, how did you choose this as your field of specialty?
I like to think it's the intellectual curiosity of the organ.
Good way to put it.
I know,
Because
right?
I had no clue. So you just want to walk around and just stick your finger up people's bums and feel around in there. But hey, that could be considered like sadistic or whatever. I don't know. Thank you for that. I appreciate
You're welcome.
that. Okay. So Chris, having looked down, the barrel of, a gun basically, in terms of heart attacks, you faced death a couple of times.
Yes.
I have too, just once, but that was enough. How did it change your outlook on life? And I know that you said you found your purpose by starting Heart, Body, and Soul Inc. But how did that affect your, how you went about your living your life on a day-to-day basis?
I think I had a greater value for life, right? Because every day I felt like I think I was grateful, but I don't think I was truly grateful. I think I took a lot of things for granted. There were just assumptions made. I woke up, I'm doing this, and everything is fine. But you realize that when you have these near-death experiences, just how fragile life is. Like after having, I didn't tell you the sequence of events, but the first heart attack was 42. I got diagnosed in September of 2021 with cancer. October of 2021, I had my second heart attack. And then I had my third coronary incident in February of 2022 after having surgery to remove the tumor and do this whole colon resectioning. And then after that, in April, I had a serious blood infection that landed me back in the hospital. So it was all these events, and every time I was there, I said, any day now I could go. So I got to make up my mind how I'm going to live my life and live with purpose and live with intention. Now, it wasn't easy because there were days where, I was frustrated to no end because I'm like, what do you mean I'm back in the hospital again? Or what do you mean I have to be on this medication? What do you mean I have to start chemo now when I'm as sick as a dog? But, the end result is I could be here longer. The end result is I would have more time with my family. So I was just like, there's nothing to it. I got to do it. I have to. So I put myself in that mindset, and it really gave me I would say a stronger appreciation for life.
If both of you can answer this question about post-treatment care. For you, it was cancer and heart attacks. But talk about the post-treatment care for somebody who, it was an early detection. Maybe they had to go through a couple of rounds of radiation or chemo. But what does post-treatment look like for somebody who has survived colorectal cancer or prostate cancer?
Yeah, definitely. Chris's insight will be very valuable because I like to say it's easy for me to say, oh, try with this, but I haven't experienced it. From my point of view, when I do see my patients after we've completed the chemotherapy, I would see them say within 3 months. And I noticed that they're not quite back to what they were before. We've been through like easily 1 year of treatment.
Chemo's tough.
It is.
I watched my mom go through it. Chemo is tough.
It is.
The best thing that they can do is keep their sense of humor, and also gratitude, But go on, Doc.
Yeah, it's tough, and we're trying to find ways to improve upon treatment without using chemotherapy. But it just takes the body a while to recover and get back. And some of the post-chemotherapy side effects that people have, especially from some of the drugs that I use, could be permanent. And the goal is really to try to minimize how much toxicity is permanent while we're still trying to cure the cancer and extend life. Chris,
Okay.
how?
Yeah, I mean, I would say that one of the things I did was acupuncture and massage therapy.
Oh,
So
I
those,
keep preaching
yeah,
about
yeah.
this to
So-
all my friends.
Listen, so if I did not do, and I told my oncologist this, if I wasn't doing acupuncture while I was going through chemo, I would not have made it. I did 9 months of chemo, aggressive, okay? And so in between chemo, like when I was off, so on chemo, once I was off chemo, I would treat with acupuncture, and then when I got back on, once I was off again, so it was off on, and I would treat with acupuncture. When I was completely done with chemo, I started massage therapy, because you didn't want to do massage while you were on chemo, because chemo, as you know, is going through the body, so when you massage, you're gonna it's not going to be a good idea. So
No.
my massage therapist advised, wait until you're done and we start. And it has been a game changer for me in terms of my recovery. I had some nerve damage here from post-surgery, which is something they say can happen because your legs are strapped in and so forth. And acupuncture helped to reverse that.
You cannot listen.
Yeah.
You're preaching to the choir.
Yeah.
Like acupuncture has helped me through so many
Yep.
of the issues that I've had in especially when it came to my car accident.
Oh, yeah.
Especially after that. That was acupuncture, massage therapy, cupping, all of the
Fantastic.
the holistic modalities in addition to what my doctors were having me do, the physical therapy and that sort of thing. So
Therapy.
and therapy.
Because I'm seeing a therapist right now as well. So that's another thing. Do not shy away from therapy because we all need it, I mean.
And that is really like nothing to thumb your nose at. Facing death.
Yeah.
A lot of people would never really be able to, or would be hard pressed to understand, like just being confronted with your mortality sometimes is extremely jarring.
Yeah.
So that's great that you let people know that therapy has helped you and you promote that. So in closing, both of you, if you could leave the audience with one takeaway about cancer prevention and treatment, what would it be?
Well, I will start with something I've already alluded to, which is it's a lot easier to cure cancer when you catch it early. It's a lot less aggressive in the treatments you need, and your outcomes are just overall better. Make time for screening. Make time for screening, make time for seeing your doctor, and make sure that you're doing what you can to be healthy. It makes a huge difference.
And I would say get to know your body. Please just take the time to understand all the things that are going on. Pay attention to the signs because your body is really great at telling you when something is wrong.
It sure is.
And so we have desensitized over the years with different foods that we consume and so forth. So take the time sometimes as often as possible to maybe cleanse, stop eating certain foods so that you can listen to what's going on, pay attention, and then address the issues by seeing a doctor. Don't hesitate. Don't be afraid to call because the most that could happen is they say nothing is wrong. That doesn't hurt.
Yeah.
We have one life, just one.
You are absolutely
Can't
right about
rent
that.
another body.
You can't.
Yeah,
You can't.
That's it.
Dr. Folu and Chris, thank you so much for dropping
Thanks for
by
having
and
us.
talking to me. I have been looking forward to this episode. And listen, you guys, you all can memorize the stats of every quarterback on all the 32 teams. You can spend 4 hours dissecting fantasy football, but you can't Google screenings to save my life or take a 5-minute, go to the doctor and do a 5-minute screening. Like, I want you to start to prioritize your health. Really, I do, because it is your responsibility. And honestly, getting older is no walk in the park. It really just isn't. So I did this episode for you to learn a little bit more about prevention and screenings, and hopefully you take this information and you are responsible with it. Thank you so much for joining me on the latest episode of Hot and Bothered with Melyssa Ford. I bid you adieu. Thank you so much.